Hi everyone. Today we will see another one role play card related to the vaccination. So the scenario is presenting at general practitioner clinic. Let me read the question. So first one, I will read it from the candidate, the patient side. So you are a 40-year-old man or woman and work as an international business manager. Your company is sending you to Cambodia and Vietnam next month for 4 weeks. Your doctor has suggested you speak to a nurse in the clinic regarding advice on recommended vaccinations prior to traveling overseas. So I am Mr. Thomas and I am going to Cambodia and Vietnam next month. It's for 1 month trip and it's for business purpose, and I have to stay there for long time. So it is mandatory that I have to get some vaccination before prior traveling. So I went to see my GP and GP advised me to go to the nurse to get the advice for recommended vaccination program. But to be frank, I am afraid of injections and maximum I will try to refuse this vaccination. So let me see my part. Explain when asked that you vaccinated yourself against flu this year and were vaccinated for tetanus and hepatitis A, B as a child approximately 30 years ago. And ask the nurse why you need to get vaccinated again, stressing that you have been managing well without these medications all these years and that you will be staying at a 5-star resort, so the risk of infection is minimal. Resist the idea of getting injections because you feel they are painful and uncomfortable. Reluctantly agreed to get the vaccination today. So this is from the patient side. And this is our role, we will see from the nurse side. You are speaking to a 40-year-old man or woman who has come to the clinic for routine checkup. He or she is traveling overseas next month with work and the general practitioner has asked you to advise him or her on recommended travel immunizations prior to international travel. So, I hope it's clear. The scenario is clear that it is a general practitioner clinic. So, let us start the role play. The first task is find out about his or her vaccination history regarding tetanus, hepatitis A and influenza or flu and the duration of the travel. Okay, so this is a clinic and you don't know the person. So the self-introduction and getting introduction from the patient is mandatory. So we will start like this. Good morning. Then the patient will greet in back. I am Resmi, one of the registered nurses working in this general practitioner clinic. How may I address you and how can I help you today? Then Mr. Thomas will explain that he is going for a trip and he wants to ask something regarding vaccination, something like that. Okay, from the nurse side. Well, Mr. Thomas, I am glad that you are going to travel abroad country, and I am glad to explain you regarding the vaccination information. So before proceeding further, may I ask you some questions regarding your vaccination history? Then he will tell, of course. Then my next question is, well, Mr. Thomas, could you please explain me whether you have received any vaccination before, like tetanus, hepatitis A and or influenza in your life anytime? And if you don't mind, could you please tell me the duration of your travel, how long you will stay in that place? Then he will explain regarding the vaccination history. 30 years before I have received my vaccinations during infancy time and the duration is approximately 1 month, like that. Then I can tell it's like in answer. Well, Mr. Thomas, thank you for your information, and as per your information I could understand that you are traveling to Cambodia and Vietnam, isn't it? And I'm so sorry to inform you that these countries are at high risk countries, and if you travel there it is mandatory to get some vaccinations, especially this typhoid, hepatitis A and tetanus. This is from WHO. So without receiving these type of vaccination, I'm sorry that maybe there will be problem for your travel. Then he will tell that no sister, just I don't want to get the vaccination because I will stay in the hotel and nothing will be there, I will not go outside, so I will manage myself, like that. He will try to convince the staff nurse. then I can tell like that, Mr. Thomas, I can truly understand your concern. Even if you are staying in if you will stay in the hotel, there are many ways to get this disease condition. Say I can tell you that hepatitis A, because this is a disease infectious condition you will get through the food, and maybe so you could not reassure, or you could not tell that the food which will be supplied in the hotel, which will be hygienic, much hygienic. Sometimes you will go outside for the trip and maybe you will have food outside. Something can happen. And for the tetanus, I can tell you that maybe you will stay some place where the even in the mud, the tetanus, the tetany, the infectious agent which is present in all over the mud, and sometimes can happen. And regarding the influenza, this is droplet. So I can assure you that if you receive all this vaccination, there will not be no chance to get these, because influenza, you can see whenever you will go for shopping or outing or for office work or something, you will expose with the external air, and this is the droplet which will present anywhere in the air. So there is a high risk to get all of these infections from the country where you are going to travel. So I'm strongly recommend you to take all the recommended vaccines within this time. So I hope you can understand. Are you following, Mr. Thomas? Then he will tell that okay sister, but still I'm feeling something regarding vaccination. Really, I'm feeling that it's painful and there will be some side effects, so that's my great concern. So we can tell that Mr. Thomas, I can truly understand what is bothering you. So I can reassure that it is nothing to be get worried. This is a simple vaccinations, and you can receive it before at least 2 weeks prior. And here this is nothing like 3 injection. There are something like a combination. So this hepatitis A, you can take it like separate, and there will be some booster doses, and this typhoid also you can take it like it's like a combined vaccination for hepatitis A and typhoid. Now you can receive these 2, and booster dose can be after 6 months. Even after you are traveling, when you will come back, you can receive the booster dose. And regarding the influenza, it is like individual dose, and you have to receive now and every year. You can take a booster doses. And regarding the procedure, it is a simple procedure, and I hope there will not be much pain, and even the side effects, there are very mild side effects like pain in the injection site and mild fever, and maybe you will feel somewhat tired only for it's like a temporary. It will not be last long even more than 1 day. So within 1 day it can be curable, and with the over-the-counter medication it's easily manageable and no need to worry. So we are here to help you. If you have any problem after vaccination, as early as possible you can come here, and we are ready to help you. So is it okay for you? Then he will somewhat okay, and he will tell that okay sister, because it's mandatory and you are telling that nothing will happen, so I'm agreed for that. So something he will tell. Then we can tell, Mr. Thomas, I'm so glad to hear that you agreed for the vaccination. So let me check the appointment for your vaccination and let me inform you. So do you have any other concern? Then he will tell, no sister, I don't have any other concern. Please let me know the date of vaccination, then I will come. Then she will tell, of course, Mr. Thomas, so please give me your contact number. So once after the confirmation of your appointment, let me inform you. So have a nice day. So with this one, we can wind up the role play. So I hope everybody got the points. Thank you.